Dr. Amy Vlahakis with Healthy Smiles Family Dentistry. Today we're going to be talking about our in-office whitening. It's a 1-hour procedure, and we're going to go through that procedure with you today with the patient in the chair. It is a venous system, and that is just the product name. It is less harsh than some of the other in-office whitening procedures. It has a desensitizer in the whitening material so that your teeth are not nearly as sensitive as they are with some of the other products out there. They get the same results or very similar results depending on your teeth, and they work really, really great. Today we're going to show you a brief preview of how we do our in-office whitening. So this is our patient, Timothy, and he's excited for today. This is Miss Wilma. She's going to be doing the treatment, and we'll go ahead and get started. We start by retracting the lips. This helps protect the lips and cheeks from the whitening material. We're going to put in some cotton. That helps as well, because we only want to get the teeth. We don't want to hit the gums. Perfect.
And doctor, how many shades can I expect to be whitened?
It varies per patient, but anywhere from 4 to 5 is a good average to see a whitening effect. So we're going to dry off the teeth. Perfect.
And how long does it take?
It takes about an hour. We can do 3 to 4 sessions of the whitening. They're broken into 15-minute sections, and each one we just add more and more of the whitening material to make sure that it's still active and still working on your teeth, whitening and getting into those tubules and getting those stains out. Perfect. This is the barrier. This protects the gums right next to the teeth. We place that on, and then we put a special light to help harden it so you won't have any issues with the gums. Perfect. This part only takes a few minutes, and then we get on to the fun part, the whitening. Go ahead and light cure it. This is why we have our shades. And we'll double check. And we'll start the bottom. Perfect. Getting on there nice and thick, that way it's a full protection for your gums. Now I will tell you that most of the time the top whitens a little bit better than the bottom does. So that's a pretty expected result because we tend to whiten our top teeth a little bit more consistently than we do our bottoms, and the bottoms just stain a lot easier. So getting off all the staining that's in there tends to take a little bit longer, but they still lighten a good couple of shades. It's definitely a good expectation to have. And we're going to go ahead and use that light again. Make this barrier nice and hard. Perfect. We'll get some more section. And we'll make sure these areas are nice and covered.
I didn't do any prep work.
No prep work necessary. We
Yes.
check your gums and make sure that everything looks really healthy. And once you've had your exam, now the fun part starts. And that's just the whitening. So it's a session of 3 15 minutes. And from there, we'll see how white you are. And if you would like, you can always do a 4th round of 15 minutes. But most people are pretty satisfied with the 3 sessions of 15 minutes. So we'll go ahead and get that started. And we'll check in with Tim after he's all finished.
Great. Thank you.
Okay, so this is whitening material, putting it on all the teeth evenly. And Miss Wilma continues to agitate to make sure that the whitening material is getting into those little tubules to get all that staining off and whiten those teeth to pearly, pearly white. So Wilma is currently removing all of the leftover whitening material. That way it's nice and comfortable when we take off the barrier. Looking good, Tim. Okay, so our next step is going to be to remove the barrier, or to rinse. We're going to rinse first, then remove the barrier. Perfect, that worked out well. Taking out the cotton and the barrier all at the same time. And gently removing the barrier. And our last step, just to remove the lip retractor. There we go. Another one. They're looking white. So that's how In Office Whitening works. Just staying away from anything that stains your teeth. Coffee, Cokes, teas, wine. Drink them all through a straw. I know I sound crazy when I say that, but it misses the front teeth and prevents any further staining, especially for the first 2 weeks. It's essential. Otherwise, the staining will go right back on there because those tubules stay open for about 2 weeks.
Great.
So, but that's about it.
Great. Thanks, doctor.
You're welcome. Alright, so starting in September and ending in October, for our anniversary, we are going to be running a whitening special. Originally, it's $250 every other time of the year, but for this special, we're going to be running it at $150. Come on in and get those pearly whites even whiter. Give us a call, 281-974-4494.